Dr. Robert Murphy, he is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
Some people may be excited. They've heard rumblings of, reducing mitigations. Maybe restaurants will open. What does this mean, and do you agree with the move?
Well, it means that in some of the regions in Illinois, the metrics have improved, and the governor and his staff had predefined metrics that a region had to meet, and apparently some of them have met it, and they're going to reduce it. I mean, I wouldn't, but I'm not in charge. But in some areas of the state, things have gotten good enough to loosen things up a little bit.
There was some news that a Florida doctor who got the COVID-19 vaccine has died, and you say that's worrisome. What were his symptoms and what happened there?
Well, 3 days after this Florida doctor got the vaccine, he's a very pro-vaccine person, actually encouraging people to take the vaccine. He developed what's called thrombocytopenia. That's a low number of platelets. And he noticed, his wife and he noticed that he had spots on his skin, which is little bleeding areas. That happens when your platelet count goes very down. He did not respond to any of the platelet treatments or transfusions, and subsequently had a big stroke and died. It's very temporally related to taking that vaccine. This is reported with other vaccines. It's probably an immunologic related condition, and fortunately it's very rare. We haven't seen this in any of the studies or in any other patients being reported, but it's just one of those things that happens.
All right, let's go through these viewer questions quickly. About what percentage of people are immune to COVID, either from getting vaccinated or getting COVID across Illinois?
Well, the last data I found was under 10%, according to the Illinois Department of Public Health, but that was 2 months ago. So we've had a lot of cases since then. So I would think it would be between 10% and 15% at this particular point.
All right, next question. Once we receive the second dose of the vaccine, will we all need to be tested for antibodies to make sure the vaccine worked?
No, it's really not recommended. The rate of developing an antibody after the vaccine is so high that you'd have to test really hundreds, if not thousands, of people to find somebody who didn't respond. Now, if maybe later on, not right after you have the vaccine, but maybe in 6 months or 12 months, learn more about this vaccine, it might be wise to get an antibody test.
All right, and what are your thoughts on women getting the COVID-19 vaccine while pregnant?
Well, this is a very understudied area. We don't really know. There's very little guidance about this, leaving it up to the doctor and the patient. It's very bad to have COVID if you're pregnant. I mean, it's more difficult to handle it. In the studies that were done, 36 women did get pregnant. 18 of them were taking the vaccine and 18 placebo. No serious things were noted, but that's a very small number. So
all right, Doc.
Have the answer then.
Yeah.
Well, Dr. Murphy, thanks for being with us this morning. If you have a question for the doctor, you can post it on our Morning News Facebook page. He'll join us again tomorrow at this time. Thanks, Doctor.
Thanks, Doc.
Okay. Have a good morning.
You too. Hey, Paul.